Okay, Bannock County Commissioners are in session. It's Thursday, January 15th, and we are starting off this morning with an update from Maggie Mann. Maggie, how are you this morning?
I'm very well, Commissioner Huff. Thank you for having me. So I want to just touch base on a couple of things this morning. One is a respiratory illness update and a measles update, and then talk a little bit about some changes that were announced to the childhood vaccination schedule. So when we look at respiratory illness right now, we're kind of seeing what we would normally expect with influenza. Our activity level is classified as very high. So the number of cases we're seeing, the number of hospitalizations are on the increase. It looks like this season is going to be more severe than last season. We've already surpassed the peak of cases from last year, both nationally and in Idaho. So that's something that we're watching very closely because it can cause premature death. And so just watching that very closely. The good news on the respiratory illness front is that COVID and RSV both seem to be kind of lying low right now. So we're happy to see that. You may remember the last couple of winters, the term triple-demic, where hospitals were a little bit overwhelmed because those three illnesses were all peaking at the same time, and it was a little bit overwhelming to the healthcare system. So we're glad that right now we're only dealing with one of those three. We have had 2 deaths in our public health district due to influenza so far this season. Last year we had a total of 12, so we're hoping that we keep that low this year, even though the number of cases is a little bit higher. We do encourage people to be vaccinated against influenza, and it's not too late if you haven't had one yet. It's absolutely okay, because again, we don't think we've reached the peak of our cases yet, and so if you were to get vaccinated now, it still affords you some protection. Measles is something that we continue to be concerned about. You probably are aware that Texas had a significant outbreak earlier it actually started about this time last year and continued for about 8 months. We have now seen pretty significant outbreaks in other states, including South Carolina and Utah. They both have really active outbreaks going on right now. Most of the cases in Utah are in the southern part of the state, but they have seen those start to creep up into the northern part of the state as well. And just the start of the new year, District 7, they had a case in Madison County that was travel associated. They believe the family had been in Utah in an area where an outbreak is ongoing. So far, they haven't identified any cases connected to that case. But of course, because there's so much back and forth between our communities, we watch those things very closely. Of concern, in the early 2000s, the United States was given a designation of being measles-free. And we have had outbreaks pop up here and there, typically associated with people traveling to other countries where measles was still common, and then bringing that back to this country. We're about to lose that designation, very likely, and so we're back to the point where measles is just naturally occurring. It doesn't have to be imported from another country. So there's the update on that. And then last week, the Department of Health and Human Services came out with a new U.S. childhood vaccination schedule. That was a kind of an unusual move because typically childhood vaccinations are set by what's called ACIP, which is the Council on Immunization Practices. So this kind of circumvented that typical process. And so I think Christy uploaded this handout for you and made some hard copies for you. I think this is a really good graphic to sort of explain the changes, which really, when you start digging into it, there aren't a lot of changes from the practical application perspective. So on the left-hand side is the quote-unquote previous schedule. So all of the vaccinations in green were recommended previously. Vaccination for dengue fever and the meningococcal B vaccine were recommended in different circumstances for high-risk kiddos. The new recommendations that came out from the Department of Health and Human Services, looks like there are some changes, but I want to just dive into those a little bit. Like the RSV that used to be recommended for all children now is classified as being recommended for high risk, but if you read the small print in the recommendation, it does say that it's recommended for all infants whose mothers have not received maternal RSV vaccine during their pregnancy. So it can be a little bit confusing unless you're really looking at it carefully. So even though it looks like a change, it really isn't. I want to jump down to the purple ones, COVID, flu, and rotavirus, that are now classified as recommended with shared clinical decision-making. Shared clinical decision-making is something that providers do on a regular basis and have done for years. I can't think of a provider that I have encountered that just comes in and says, these are the shots that your child is getting to date. It's always a conversation about what is recommended, what questions does that parent have, and it's the parent, even though this is the recommended schedule, it's the parent's discretion as to what vaccinations that child receives. So they've added this language of shared clinical decision making, but even with the ones in the green, that's what's happening. It's a conversation between the provider and the parent. The one that we're most concerned about probably is the hepatitis B, which now is labeled as recommended for high risk, shared clinical decision making for others. Hepatitis B is a little bit tricky in that historically infants have received their first dose of that in the hospital before they go home. And the reason for that is if they're exposed to hepatitis B and acquire that virus in their household, that often results in a chronic lifetime infection with hepatitis B, which can result in liver damage and early death. So the universal recommendation to give Hep B to all kiddos before they leave the hospital has dramatically reduced the number of children and adults who are living with hepatitis B. This change is concerning for a number of reasons. One is that we don't know the status of every woman who's delivering an infant as far as hepatitis B goes. If a woman hasn't had access to prenatal care, we definitely don't know that. So there is definitely a concern that we're going to see the number of cases of hepatitis B in kids go up because if that birth dose of Hep B is missed. So that one is pretty concerning. So even though it sort of looks like they've cut the number of recommended vaccinations pretty significantly, when you dive into the details, the recommendation is still there. It's just with that shared clinical decision making. The Committee on Immunization Practices is scheduled to meet in late February, and we don't know what they're going to do with these recommendations, if they're going to sign off on them. We also don't know how these changes are going to impact what's called Vaccine for Children, which is a federal supply of childhood vaccinations that if providers participate in the Vaccines for Children program, they don't actually purchase the vaccine. The vaccine is provided to them, and so they're able to give those to children without the cost of the vaccine. It's just an administration charge. So they're still kind of some things up in the air about this, but the bottom line is really not a lot has changed. It seems to be a little bit cosmetic. So I'm happy to answer any questions that you might have about that.
Commissioners?
You have a crystal ball? What's going on? And the reason I asked that question is I know of a certain faction of people that are just anti-childhood vaccination. Is it poor information? Is it misinformation? Or is it just they're gleaning what they want to hear, just like we do with
Yeah.
all our media now?
Yeah.
We tune into what we want to hear. So do you see that changing at all for our youth? And I have grandkids, and I'm just as concerned with I guess, the migration of our attitude towards immunizations. I come from old school where we took polio sugar cubes
Yep.
because polio was rampant in America. Now we pretty well have it wiped out.
Yes.
But what worries me about the measles deal is it's going to affect another generation, and we don't know yet.
That's a really good question, Commissioner Bullock, and I think it's very complicated. I mean, I think part of it is that because so many people were vaccinated for so many years, we haven't really seen a lot of these vaccine preventable illnesses on a regular basis. So people don't really have a good understanding of just how damaging they can be, and how tough the outcomes of that can be. Something like pertussis or whooping cough, which is vaccine preventable. If you've ever heard an infant or a small child trying to breathe who has pertussis, if that doesn't motivate you to want to do something to prevent it, I'm not sure what's going to. So I think number one, we just don't see a lot of it anymore. So it's sort of like out of sight, out of mind. I think all parents are trying to do the very best thing for their kids that they can. There is a lot of misinformation about vaccines circulating in the world, and that's unfortunate. And people have more access to information now than we've ever had before, right? The pitfall of that is some of it's solid, reasonable information based on decades of research. Not all of it is, and research can also be manipulated to tell a different story. So what we do in our clinics, our nurses are really, really good about meeting parents where they're at, helping them identify like what their specific concerns are. Like sometimes parents don't want to get multiple shots on one day, and we work with that. If they only want to have one shot for their baby that day and come back on a different day, then we will do that. But we just try to provide what our understanding of the best factual information is. And I know other providers do that too. But yeah, it's, Idaho now has the lowest childhood vaccination rates in the country. When you look at the 2-year-old vaccination rate, which is a milestone. And we kind of for years went back and forth between Mississippi and us being the lowest. And then when Governor Kempthorne was in office, he made childhood vaccinations a huge priority. He was the one that in his administration, what's called IRIS, the Idaho Immunization Reminder Information System, was developed and put into place. So that's a registry that, like, if a child comes into a physician, that child can be looked up in the registry and see if they're up to date on their shots. For years, that was an opt-out registry, so like a parent had to say that they didn't want their child in that registry. Now the law has changed, so it's opt-in, so a parent has to say that they want their child in the registry. But the reason that registry was important is there were some like missed opportunities with the healthcare system. Like maybe a child, they go in a couple times a year to see their regular provider, but if they maybe went to an urgent care because, they weren't feeling well or they needed stitches or something, then they could be looked up in that urgent care, and if they were due for a vaccination, that could be provided right then and there, rather than having to make another appointment. So, I'm a little bit surprised that measles hasn't kind of taken off here. There have been a number of cases in the Panhandle area. There were cases earlier this summer up in the District 7 area, like Bonneville, Madison, Jefferson County. I'm surprised we haven't seen it here yet. We did have one case in Franklin County, but we classified it as a suspect case because the parents didn't want the child tested. The child was too young to have been vaccinated yet, but had been in an area where cases were present and had all the classic symptoms, but we couldn't count it as a case. We had to label it a suspect case because we didn't have a test result. So,
Thank you.
yep.
Commissioner, anything?
Thank you. I mean, that's a lot of information. I just trying to think, how do we encourage people to take care of their own children? That's
Yeah.
a challenge.
Well, I mean, again, I think parents are trying to do their best, so I think it's just a matter of continuing to share factual information about the benefits of vaccine and that they are very, very low risk. I mean, we do have decades, these things are very well researched, and it's gonna be interesting to watch what happens.
Well, I think vaccines took a little bit of a black eye during COVID.
Yep,
I mean, and it,
they did.
so we need to know the truths and everything that.
Yep.
That's what is the scary part, is there is a lot of non-truth out there, but there's, how do we
Yeah.
do our part?
Yep.
I just want to shift gears for a second.
Yeah.
With the legislative session starting, what are you watching and concerned about?
I'm very concerned about the potential for Medicaid expansion repeal. I think that with the deficit and just what we're hearing, I think that that's a real possibility. And already with changes to Medicaid that have already occurred, that you all I know are very aware of, as well as the elimination of the premium tax credits for people who are covered by an exchange or Affordable Care Plan Act. That is the potential to really, really significantly limit healthcare access for tens of thousands of people in our state. And it's interesting to me that we've been awarded as a state this massive rural health transformation grant. But that is very focused on systemic things like telehealth. But if people don't have health insurance, they're not going to be able to access telehealth. And as I know you are very familiar with, we no longer have the county medical indigency funds or the state CAT fund. So if we have tens of thousands of people who no longer have health insurance coverage, that's a problem. So that's probably the number one thing.
Okay, thank you.
Yep.
Okay, anything else for Maggie?
Thank you.
Okay.
Yes.
Great.
Thanks very
Maggie.
much. Have a good day.
Scott?
Bring the whole crew up. Not did you? Bring the whole crew up. Introduce everybody.
I'm Scott Crowther, Event Director. You mind introducing yourself to the record?
Lori Murray, co-president of the Symphony.
Carol Burnett, the other co-president of the Symphony Board.
Logan Anderson, Executive Director of the Idaho State Civic Symphony.
So as part of our celebrations for next year's 4th of July, we've been working with the Idaho State Civic Symphony to actually run a symphony, or to have a program on the 4th of July before the fireworks. So do you want to describe kind of what we've been talking about, and I'll talk about the details.
Yeah, of course. Well, thank you for having us this morning. This has been a project many months in planning. We first met with Scott and Commissioner Moser, I guess it was April, I want to say. So it's been a long time coming, so we're very grateful to be able to talk to you all today. Our conductor, Nell Flanders, had an idea to have a giant performance outdoors on the 4th of July to commemorate the 250th anniversary of the Declaration of Independence. And so we approached the county about the possibility of using the Portneuf Health Trust Amphitheater. And this performance is going to be a huge undertaking for the symphony, and it's a nearly 100-year anniversary. This will be the largest performance we've ever put on. And so one of the things that one of the hurdles that we need to do to be able to cross, including paying for musicians and lighting and sound costs, we thought, well, we were hoping that maybe the county would want to partner with us on this endeavor. This is going to be a free concert. We're not going to make any money off of this. So we wanted to just provide a community service to the residents of the county and surrounding areas. And so that's sort of the background on what we're looking at. So it'll be a performance with full orchestra. We'll have a guest pianist also performing, and we plan to finish just a few minutes before the fireworks begin, and attendees can stay there on the field and watch the fireworks from there.
So from our standpoint, we would waive the fees of the venue rental as part of this. We would offer concessions and sales, which would include alcohol, which would mean that we would have at least a minimum security staff presence over there during that time. And then it would not interfere with the way we do our normal 4th of July activities. So it wouldn't change the setup. We'd still run the stage with some local bands up on the stage, up on the field. We think we're going to kind of draw two different groups. So yeah, parking is going to be an issue. But that's about it. So, questions, thoughts?
So the county's part is the facility. Dollar amount, there wasn't any dollar amount, right?
No, yeah, so we'll have, I mean, there really isn't necessarily concessions cost unless we sell something, because we have to buy concessions for our shows anyway, so
But it would be the staffing for
yes, so
the concessions and the alcohol
yes,
sales.
so there would be staffing for that, which we also sell
That
alcohol.
wouldn't be a cost that
They wouldn't go to those
they
guys.
would be.
No, it's not. I'm just saying it's going to be a cost of the event.
Yeah.
Yes.
And obviously, anytime we open up the amphitheater, but these guys would be responsible for all the production, the lighting, everything like that. We do what we could to help them, when it comes to, we'll have our contracts that have forklift, and we should have some of that stuff in place so that there's some things for them to use to make their lives a little bit easier. But I think it's a really good idea. I think it's a great opportunity for us to utilize the amphitheater. If we generate a little bit of revenue off it, great. So,
I think it's great for the community to actually see your organization at work as well too. Probably a best kept secret. So I think with that 4th of July activities, we have an opportunity to, coupled with the 250-year, the military and everything else, I just think it's a positive move forward. We just got to make sure we think through all of the process of parking.
sure.
Not only that, but traffic control. Not just while they're parked there, but as they get out and which directional.
And we typically don't do traffic control. We do have the sheriff's department up there on the 4th, and they'll break out and do a little bit of traffic control, but traffic on the 4th is
We
crazy
probably need
regardless.
to engage a conversation with the mayors, because they can pitch in and help for this communication as far as
Sure.
traffic control, because it all leads to their directions or whatever. I think that's a discussion, we're going to be having a discussion with those leaders anyway shortly.
Sure.
I'd like to, get some of this stuff start put together so they can plan on this as well.
So typically, we will reroute traffic a couple different ways. Fairgrounds Road can only turn right, out of the amphitheater can only turn I think it's right. Off of Fairgrounds Road onto Venture Way can only turn left. So we really do kind of funnel it out. That's where they have their points of traffic control. And we'll figure that out logistically when we talk about the 4th of July stuff, but
Okay.
that's historically what we do. This could add additional people, additional bodies, and we have the parking that we kind of created last couple of years back behind the amphitheater. So that's something that we'll try to maybe utilize that a little bit more for this activity. But yeah, I think it's a great opportunity to showcase the area and also just to add to our already fantastic 4th of July celebration.
That might be a conversation we had, is the parking area that's right off the pond, right off the amphitheater. Reserve that for the symphony as they're coming in.
I think it would just be too tough logistically to try to do that. It's just got to be first come, first serve.
With their instruments and stuff like that.
So we might be able to block off to the amphitheater like we do for concerts.
Yeah, and
Or we
that's
block
what I'm
off the
talking
bottom
about.
road and then we allow people that are going, because there's going to be some aspects of this are going to kind of fall into our concert contract, right? Like all the people that buy suites from us are going to have access to some of the suites there. So then some of the suites that we hold will reserve for the folks that they have, suite obligations for as well.
Yep.
So we've talked about all of these, and they should be in our contract as well. So.
And we'd also, like to recognize Bannock County as, a presenting sponsor of the event. If there's no problem in doing that, I know this is probably an in-kind contribution. If you're amenable to that.
Yes.
Okay.
If that parking becomes an issue, I would volunteer to help with a golf cart crew, helping people get their instruments up there if it becomes some sort of an issue when we're getting there.
It shouldn't
Just
be,
let me
because
know.
we have the bus parking, right,
Yeah.
that we have for tour buses. Like that whole area up there can be for performers, right? It just means that we'll put a security person up there. I mean, I think reserving that side is not that big of an issue because it's not like we have a ton of people that park on that side. It's just touching anything in the main parking area. That would be where I would see, some potential issues. So I think if we wanted to put somebody down and block it off like we do every other concert night, we could. But I think that we'll have plenty of room for people to get their instruments, to get everybody up there. It's just going to be people that want to attend. And we do have the lease with Idaho Power to access the parking lot across the way. If the weather's good, right, we don't have to put out any signage, but people can park there, right? So we can allow people to park there if we want to. But we just haven't spent the money to try to make that into a usable parking lot. So.
Not to discount it, but that service of providing just elderly people, it would be nice if we had
That's
even
true.
a shuttle service like they do at the fair in Blackfoot, just to help people no matter how far they park, but especially those who have a hard time walking or whatever it is. That'd be a great opportunity for somebody to provide shuttles back and forth to get them to the venue or get them to where the
I just
4th of
heard a
July.
volunteer group.
Well, I did too. I was kind of jumping onto that, but
I love the symphony, so I'm all about it.
I just think, you know how hard it is to move around.
yeah.
Anybody that's been up there on the 4th of July, like we go from using side-by-sides during the day to using golf carts at night to walking everywhere because it locks down. And then also, if you're ever driving a side-by-side or a golf cart up there, you'll have a million people, hey, give me a ride, hook me up, So if you're running a shuttle service, it's going to be busy.
That sounds good to me.
I don't think it's a bad idea. I just think
Yeah,
it's
I just think we need to
logistics.
look at it.
Yeah, it's going to be
as
a
an
tough
option.
one logistically, so.
So,
Okay, any further questions? I would entertain a motion then.
I'd go ahead and make the motion that we sign this agreement with the Idaho State Civic Symphony, and we will have a great time on the 4th of July.
Okay, any further discussion?
Who's in charge of the weather? After that rainstorm we had last year, and that survived, but boy, they can come out of nowhere and it would affect everything, so.
So the-
I'll be in charge of the
volunteer.
Yeah.
So the weather would follow all of our, I mean, anything we do in the amphitheater kind of follows all of our rules that we have for, it's lightning, right? So if there's lightning in the area, which that falls on me, right? If there's lightning in the area, then we will evacuate the amphitheater if it's within 5 miles. But once the lightning passes, if it's raining, people get to sit out there in raincoats or come back in a little while, like they did last year, come back for the fireworks, so.
So, we need a signature here. Okay?
Sure.
Yep.
So,
We do have our copy, but we can sign a different copy if that's preferable, so.
We'll just have you sign this one, then we'll go on there.
Wonderful.
Okay, we have a motion on the floor. Any further discussion? All in favor, say aye.
aye. Okay.
We'll just have you do that real quick.
Thank you so much.
So I wonder, has the military said anything about wanting to be a part of this?
No,
I haven't heard of it.
no.
You would think they
But
would.
it's the symphony's 100th birthday, right?
So it's coming up, yeah, so.
It's ISU's 125, it's Chamber of Commerce's 125, and then the US is
Yeah.
250.
And we'll probably.
A lot of birthday
we're gonna have to
cake.
A lot of
bring
birthdays
people.
happening.
That'd be cool.
We are unclear about whether, when the first year of the symphony was, whether it was 1925, 6, or 7. But we found an old poster that we think is from 1926. When they were renovating Fraser Hall, they just sent us a message a few months ago with that pretty impressive find. So,
Well, we just said it was 26 on the record, so.
I guess so. I guess it's official. All right. Thank you so much.
Okay,
Thank
thanks.
you.
All right, and then Carolyn? You want to introduce yourself for the record?
Sure.
My name is Carolyn Anderson Merritt, and I'm with Rock Creek Ranch Roping Productions out of American Falls.
So Carolyn reached out to us wanting to do a fundraiser for, talk a little bit about the fundraiser, and then I'll
you bet.
talk about the details.
Yeah. So we had scheduled to have a roping event this coming Saturday. I talked to Terry about it way back in the end of October, first part of November. But just before Christmas, we were made aware of a family in the cowboy community that I guess she's their youngest daughter, Visalia. She's 8 years old. She was diagnosed with leukemia, and this follows right after her dad had an emergency appendectomy, however you say that, pardon me, right around Thanksgiving. They are a true blue cowboy family. Her dad day works, mom stays at home with the kids. Insurance is non-existent for them, so this was a huge hardship on them. They had a Life Flight Visalia down to Boise to St. Luke's, and she just finished up her first round of chemotherapy this last week. I think she's gained probably 50 pounds in just water retention. It's a rough deal for her. But they're trying to make the best of it, and they're keeping going. And one thing about the cowboy community is that we are big supporters of each other. We like to rally around everybody. And so we saw that we had this event on the books, and we said, let's make this a benefit. So what we're doing with that is we're taking half of the pot, so half of all the entry fees is going to go directly to the family. So the family is Cody and Dally McKenzie. And then the other half of that is going to go towards covering our production costs and then paying out prize money to the contestants because, they still want to get something out of it. So I requested to have the fee waived for the facility, and Scott agreed that we could maybe do half of that, which is great. Anything helps us out to just kind of minimize those costs so that we can give the most that we can.
So as you guys are aware, we do get a lot of requests for charity benefits and fee waivers and stuff like that. Really, I just looked at what it would cost us to set up the event. So the fee for this is $685. My suggestion is maybe that we do a 50% fee reduction. That will at least cover our staff cost, tractor, fuel, all that kind of stuff. And then, so that's my suggestion.
Okay.
Again, the initial ask was for the entire fee to be waived. I'm just saying that I think that maybe covering our costs would be good.
And you always got to ask big and work from there. So 50% would be great for us too, so. And just like with the symphony, I mean, we will recognize Bannock County for your contribution and your help in this project with us too, so.
Well, since you're basically splitting the pot, I think that's only fair that we probably
Sure.
follow that same line is what would be normal, we'll split it with you. That's my recommendation, that we go ahead and do the 50%. What is that the number you come up with?
Yep.
That would be my recommendation in a motion if no other discussion on it.
Jim?
It's challenging for me. I mean,
Yeah.
honestly, because we spend a lot of money on that facility. And we have a lot of people, like Scott says,
Yeah.
come in and ask. But when you come in personally, that's why we kind of request that you come in and state what the circumstances are and stuff. Running the tractors and running the skid steer and stuff like that, is that them or us? How do you?
So we'll go down and groom it. The ranch roping takes a lot of panels. They use a lot of panels. And so there's a panel rental in there, $5 per panel. When we set it up, it takes my guys, I can send 5-6 guys down there and they can spend a half day setting it up, half day turn it down. So the cost to do that is actually really high. So what we did last time was we take the panels down to them. Here's your panels, you guys set them up. We'll take it down there, and I think you guys use the skid steer, right?
Yeah.
So they use the skid steer and tractor, and then they set the panels up, and then they're required to take the panels down, right? And then we'll just bring them back to our yard. So that's kind of how we reduce our cost. But, the panel work is not necessarily something we have on the fee schedule. We have a panel rental. But depending on how elaborate the panels get set up, I mean, it takes a long time to set up a facility within a venue.
And it's probably a little bit easier for us to do it just because we already have the visual in mind and know exactly, But also with the ranch roping too, the difference with us and some of the other events that happen in there, we'll set up the panels, we'll work the arena one time, and then we're done with the groomer. We don't use it, it's not in every run, it's out there being ran and using fuel and getting wear and tear. We're very minimal, set it up and run with it.
And then do you charge people to come and spectate?
No, we do not charge an
So that's a
admission
free
fee.
event.
Yep.
Okay,
Okay,
I'm good.
okay. Well, we have a motion on the floor. Is there any further discussion? All in favor, say aye. Aye. Okay, good luck.
I appreciate you guys. Thank you so much.
Thank you again.
Thanks, Scott.
That's all I got.
Okay, thank you. Scott, you want to drop,
This one's yours.
is that the ISU one?
This is the symphony.
Yeah,
Yeah, I'm just gonna take it downstairs. I'm gonna.
we can just put it here in the packet. Madam Assessor and friend.
You guys looked like, Scott looked like he was sitting down in a bucket.
So we're here for Board of Equalization until we need to go into. It's okay.
Help her out, Randy.
So we're here about Board of Equalization, so I don't know.
So I'd make a motion that we go into the Board of Equalization.
Okay, we have a motion. All in favor, say aye.
Aye.
And we have nothing. We have had no appeals for occupancy or the subrole. So we are going to finalize that as of today after Board of Equalization. And then the treasurer will be sending out tax notices within the next week or so. And they will be, the first half is due February 20th, and then the second half, June 20th. So right now we've had some phone calls, but we were able to work through those and explain. Other than that, we have had nothing, which is typical on occupancy and several, to be honest.
Okay, sounds good. Any other questions? No? Then I would move that we exit the Board of Equalization. All in favor, say aye.
Aye.
Well done. Thank you.
Thank you.
I like them types of Board of Equalization.
Yeah, those are good.
We should do that in June.
Yeah. Okay, Jason.
All right, Adam, you want to come up? So Adam and I have been dealing with the Kimport purchase that the county is doing, and that lease process. That chair's going to get something.
Yeah, it's down.
We're into the hundreds of emails going back and forth between all the agencies and everyone really has been good to work with. But the Idaho Department of Lands is who we've been waiting for, and we finally have all of our information from them, contracts and leases and this and that's all back and forth. The curveball that we have been thrown by the Idaho Department of Lands is they want us to pay the lease for this year, which has already been paid by Day Wireless, which is $11,700 and change. But that's a non-negotiable item. Adam has in his budget
$9,100 for this was our rent on the site already.
so we can use that portion of the money. I already had Christie make out a check for the correct amount.
It's in your commission report.
It's in the commission report. We will have to come up with some extra funds. However, then, we are going to immediately start receiving revenue back from all of these other entities that will be leasing the
Yep.
tower from.
BIA, Bureau of Land Management, and Bannock, Bingham County. They all currently pay rent to Day Wireless. They will pay that fee to us directly rather than Day Wireless. And as Jason mentioned, Day Wireless's rent, our actual land use cost up there is about $2,000 a year. We were paying about $8,900, $9,100 a year to Day Wireless. So those costs recognized have gone down significantly. We're going to pass some of that savings on to those other agencies in that will reduce their cost to what their actual land use fee is, plus a small percentage that we'll bank for maintenance.
So as we receive that money back in, if we need to at the end of the fiscal year, we should be able to open the budget, hopefully, assuming revenues have been met, to cover the check that we're paying that's more than what we have budgeted.
The other little curveball that I want to chat about, I would ask that you authorize not only this $11,700 and change to be paid out today at the closing, but also maybe authorize up to $1,000 in any other prorated fees that come. There were a couple of emails yesterday in the chain of, well, this amount is going to be prorated and this amount is going to be prorated, and they may ask us to pay a couple $100 for some proration of some fee. I don't know that that's going to happen, but I would like to get this buttoned up today. And if we do that, if we do spend the money, and I have Christie do a manual check right then, so that we can get it closed, we'll just ratify it next week on Tuesday's meeting, and hopefully they've dotted all their i's and crossed their t's, and we won't need to use anything, and I'll just report back on that next Tuesday, one way or the other.
Okay. Any discussion on that?
So,
Take it out of Carol's travel budget.
so is Day Wireless entitled to any refund? Since they're
Yes,
paying
so
that
yes.
11,000 and then, okay, because, man, somebody's getting hosed.
No, yeah, they're going to get a refund
Okay.
from the Bureau of Land, Public Land. And so we'll, basically what, the fee runs from January 1 to December 31st. So they paid it back at the beginning of December because it was due at the beginning of December. It actually comes due, I believe, December 1st. So we're paying it because we're taking it over. That covers us for the entire year. The budget difference is just a couple $1,000s, so next year I'll budget for $11,700 versus the $9,100. And again, like I said, we're going to recoup almost all of that in fees, at least 3/4 of it from these other agencies of that fee. That's the actual land use fee. If you went through and added up what Day Wireless was charging for rent to each of these agencies, it's almost 4 times. And that included their maintenance costs and such. So we're going to augment our fee collection. These agencies are going to get a discount on what they were paying, but we're going to augment it by a little bit in order to cover things like HVAC, preventative maintenance, roof, things like that. And we'll just bank that money, so.
And we'll have, what we'll do is the money that we anticipate coming in will increase our revenue that we currently are getting. So that'll be built into next year's budget.
Yeah.
And then we're going to try and watch, we might start doing a reserve for Kenport out of our reserves. So if we roll money forward, we may come and ask the commission to do a reserved amount so that we know we have maintenance costs for Kenport, as opposed to just all of that money sitting and potentially being used for other purposes.
Yeah.
Adam,
So-
you said yesterday, taking that to a 12-channel, right, repeater?
Well, yeah, and that's above and beyond. So Kinport, if you, we are on the ICAWIN, the statewide radio system. Kinport is the busiest radio system site in the entire system. It's the only one that busies out, and the reason for it is the coverage range. It goes as far as Idaho Falls and as far as Rupert. A lot of agencies share connection to that tower. We're looking at, in probably 5-ish years, we're going to have to be replacing the repeaters in all these towers with the new technology. The current repeaters are going to be end of life. I actually anticipate they push it out a little bit, but we're talking 2030, 2032, something like that. My idea is Chinese Peak gets considerably less usage, but it has more channels. Right now, Kinport has a 6-channel system in it. Chinese Peak has a 10-channel system in it. And looking at the system utilization, it would be much better if we flip-flopped that and put a 10-channel system in Kinport, 6-channel system in Kinport. So that's one of the things that we might bank some of this money towards, the upgrade of that, because it actually would benefit everybody who shares our system. That's also, Idaho State Police, Forest Service, BLM, it's everybody that uses the radio system, so.
Cool. So the extra money that we're going to be receiving would be then assigned to a reserve amount? So depending on what happens a year from now, so we will pigeonhole that, so.
Yeah. Yeah, that's the idea. If we put it into a reserve account for maintenance or ongoing, if we don't need to use it for maintenance, which, we do preventative maintenance up there, but it just depends on if things go bad, HVAC needs replaced or a generator propane. If we don't use it for that, then we would use it towards the improvements on the site when we get to the point of needing a bigger repeater system up there. And that's inevitable. It's going to happen, but I can't give you an exact timeline. We're talking 5 to 7 years, so.
But that would allow us time to build that dollar amount.
Yeah,
to cover
which
it.
is, we're banking other fees that we are recouping, like the Idaho State Public Communications Commission paying for our Vesta maintenance fees. We're gonna bank a portion of that towards this. We completed the microwave upgrades, we completed the Ethernet upgrade. It's just the next iteration in the chain, and we're just trying to shave our costs as much as we can in order to build that. Was one of the reasons we went for the 10-year deal with the CAD system, because we now know what our cost is. We cut that maintenance fee in half by doing that. Same kind of deal with the Vesta system. We're just going to bank that money, and when we're ready to replace that repeater equipment, we'll have some money towards it.
Okay, good plan.
Yep.
So the extra funds, did you come up with any
It'll just be bottom line right now.
bottom line?
Yeah, I do have it. We have a general maintenance fund in 911 that has it's for our unanticipated things that go wrong. There is enough money in that to cover this for the difference of a couple $1,000.
And then we'll just gauge the budget and watch if we need to open it.
I'd make a motion that we go ahead and approve that with the addition of an extra $1,000 for anything that comes up in the next few weeks to close this deal.
It should be today, or possibly tomorrow. We should be done. I've been emailing like a madman the last week with this group. You should see these email chains. It's ridiculous, but we should be done today or tomorrow.
And then ratify it Tuesday, so that we know what was spent, if anything.
Okay. All right, we have a motion. All in favor, say aye. Aye. Okay.
Cool. Thanks,
Okay,
everyone.
get her done.
Thanks, Adam.
Yeah, absolutely.
That brings us to the claims agenda. Is there any comments, questions, or concerns on that?
I got a couple of deals that I talked to Christie about. One is that when I had talked to Dan, and they had that damage up in the prosecutor's office with the carpet, and,
Down here in the courts?
no,
Oh,
no, we had that's what this is,
Oh.
in the prosecutor's office, they had our cleaning company put some chemical down
oh, I didn't know that.
that burn it up.
Yep.
And we're paying the price of it, and then we're gonna get reimbursed by the insurance. And I just wanted that to be made sure. And this is one of them deals that I'll go in and talk with HR. When something like this happens, Christie needs to be aware of it, that we're paying out one place and getting money back in another place, and so that, in that. And then did you find anything out
Yes.
about?
And then the other one was $3,200 for the jail. It was a sprinkler line repair in the max unit, housing unit, so.
And I hadn't heard anything about that, and I didn't know if that was an insurance deal either or not.
Yeah, it
And
was
it-
probably an inmate
that's
who got
why-
a little frustrated and
That's what I was kind of wondering, what those two bills were as I went through. But other than that, I mean, I have no problem. with-
Okay.
Does any of that, and this, I saw some tort claims coming out, and there was some complaint. Is any of this related?
You see, it's
to
the same guy?
damage? Well, I didn't, but I'm just, was there any of this related
I don't
to
see
any
tort
of,
claims.
that'd be the only thing I would worry about is if there was some damage or whatever, and so, but anyway,
And if it's Joe related, I'm sure Tony's handling the,
yeah, so
The
I
charges.
just kind of, so,
And I'll just say that those tort claims are the same guy that we had about 6 months ago.
Yeah.
That
So he's back.
wanted to be a millionaire when he left the jail.
yeah, so anyway. I will make the motion that we go ahead and approve the items on the commissioner's report.
Okay, we have a motion. All in favor, say aye.
Aye.
And that will stand us at recess until 2:30.